Hey everyone, what's up? This is Dr. Charlie Johnson, a physical therapist, orthopedic specialist, and someone who helps people all around the world with back, butt, and sciatica problems that are sort of mysterious and just won't seem to go away. So in this video, I'm going to share with you the real source of most buttock pain so that you just don't miss or overlook it. Every day I chat with folks all around the world who think that they have Piriformis Syndrome causing the pain in their butt, but they don't. And instead, they're actually shocked to find out, or when I can kind of prove to them, if you will, that their back is the real source of their butt pain. Now, if you're watching this, you might be thinking, and it is very possible that you might be saying to yourself, or saying to me if I was there with you, right? Like, but Dr. Charlie, I don't have any back pain, or there's very little back pain, right? All my pain is right here, smack dab, in the middle of the butt cheek. And I would respond with like, look, I know, totally understand where you feel your pain, but I am telling you that even if you do not have back pain, it is very possible that something else, your back, could be causing the problem. So regardless of whether you have back pain or you don't have back pain, if you have buttock pain, please stick around to the end of the video because chances are very high that your back is actually the cause of your buttock problem and what you think is Piriformis Syndrome, but it's probably not. All this to say that it's not that I, think that Piriformis Syndrome doesn't exist. I've seen things that are very consistent with Piriformis Syndrome. But I am telling you that the number one most common cause of a buttock problem is a problem in the back. So in this video, I want to share with you some simple tests, movement tests that you can do at home to rule out or make sure that your back is not causing your buttock pain. But before we chat about these specific movements that you can perform, here are just a couple quick tips that you should know. And look, also, if you have not yet checked out my DIY diagnostic guide, I call it a better than an MRI DIY diagnostic guide. I want to save you some time, energy, and money. I lay out step by step all the exact things that you can do, kind of look at, think about as it relates to figuring out the most likely source of your pain. So if you haven't done that, I recommend you do so. You can click the link above and or in the comments/description below to download that for free. All right, so tip number one is something you need to understand before we go through specific movements, all right? So number one, upstream problems cause downstream effects. Super important. So just understand that where you hurt isn't always why you hurt, okay? So just because your butt hurts doesn't mean you have Piriformis Syndrome and or a problem in the butt. The structures in your body have the ability to refer pain elsewhere. In other words, right, referred pain is just basically pain perceived at a location other than the actual site of the problem, the real problem. Or another way to define referred pain is when you feel pain in one part of your body, but it's actually caused by a problem in another part of your body. For example, most of you are probably familiar with the idea that, hey, you could have a problem with your heart, but you might feel pain in your jaw or your shoulder or even your bicep. So again, the structures in the body have the ability to send pain signals to other body regions. A joint or disc or ligament problem in your back, for example, right, that has become irritated or aggravated for some reason, has the ability to send pain to different parts of the body, the butt being the most common area of referred pain from the back. It can also send pain down into your hamstring or into your calf or into your ankle or into your knee or into your toes. It can send pain anywhere below it. And what's crazy is that you may feel no pain in your back at the site of the actual injury or irritation, right? And all of your pain in your butt or your leg or in your calf. And this really throws people as well as healthcare providers for a loop, right? And it's often missed. Because you feel very little or no back pain, right? It's very common to overlook that and be like, meh, it's not causing any issues. Do you have any back pain? No, maybe years ago, but not right now. It's just here in my butt or in my calf. And so people miss it, they overlook it, and then it leads you kind of down the rabbit hole of treatment because you have pain in the butt and you start getting treatment. Think injections, stretches, massages, all to your butt cheek because that's where you hurt, but you're totally missing the mark. You're aiming your treatments at the wrong source, at the wrong target. Now, real quick, what do I mean by upstream problems cause downstream effects? Well, we just talked about referred pain, but I want to talk to you specifically about how structures in your back refer pain. So problems in your back refer pain downstream. And if you think of your back sort of as like the mouth of the river, right, before your legs split off, and the current goes downstream through your butt and all the way down to your toes, and the water would flow out through your toes, right, then your back is the most upstream part of that whole system. And anything downstream, your hamstring, your calf, your heel, your foot, right, that would be below the back or downstream from the back. And if you disrupt something upstream in a river, right, or in this ecosystem of the back and the legs and things like that, right, then it can cause downstream effects. It can impact anything downstream. But a downstream problem will not go against the current and cause an upstream effect. So to make this super clear, a problem in your back upstream can cause anything below it on one or both sides to be painful. Problem in the back can cause you to feel SI joint pains. It can cause you to feel piriformis pain in the center of your buttock. It can refer pain anywhere downstream, including your hamstring, even into your calf, your heel, or your toes. But a problem downstream in the buttock will not cause pain or refer pain upstream. A problem in the hamstring will not refer pain to the buttock or to the back. A problem in the calf will not refer pain into the hamstring, into the butt, or into the back, right? So if you have a downstream problem, it will not refer pain upstream, but a upstream problem can refer pain into any of the structures downstream. All right, so hopefully you get my point via that demonstration, right? If this doesn't make sense and you're like, wait, what's upstream, what's downstream, right? Just leave me a comment below and I'll find another way to explain it. And this brings me to my second tip: consider a common denominator. So it's super common for people I chat with who have back, butt, and leg problems, right, to have been given many different diagnoses to explain the pain, right? And so they're super confused because they chat with a back doctor and they have a disc problem, a joint problem, degeneration, arthritis, whatever. Then, they chat with the hip doctor and the hip doctor thinks that they have a hip problem or a Piriformis Syndrome or an IT band problem or a hip bursitis. And then they chat maybe with the foot doctor because maybe they have some pain going down their leg as well, and they all of a sudden also have plantar fasciitis. And all of this is just magically happening all at the same time. But what are the chances, right, that you're going along okay in life, and then all of a sudden you have boop, 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 like all these different diagnoses, right? Not very high, not very likely. So chances are you'll have one of these things at some point in your life, but they're not all going to fall on you at one time. Your body isn't just going to break down, the world's going to come crashing down, right? And all of a sudden, like, you're going to fall apart. And so here's what you want to think about. If you're watching this and you're experiencing some form of butt and leg pains, maybe in different areas, or maybe it shifts around or something like that, and you're confused because you've been told you have many different things, or you're just not sure what the heck is going on, right? Ask yourself, is it possible that one thing, just one thing, could be causing it all? Could explain all of the symptoms that you're experiencing? So rather than having many different independent diagnoses or different problems causing your pains, right? My experience tells me that there's usually just one problem at the root of it all. A common denominator in single thread that unifies and explains everything, all the symptoms that you're experiencing. And to be clear, it's usually upstream. Right? The back causing referred pain into multiple different areas on one or both sides, as we talked about earlier, and or a sensitive nervous system. So maybe you have an irritated sciatic nerve that's causing pain in the back, the butt, the leg, the knee, the foot, all of that. Or it could even be a sensitive nervous system even higher upstream, right? The CEO, the brain. And this sensitivity could be causing you, to feel pain or sensations in multiple body regions that just sort of don't make sense. And doctors, going the traditional route, just try to explain it by throwing all kinds of different labels on you. When in actuality, at the end of the day, usually random aches and pains are caused by just one common problem, one common denominator. All right, so now that you understand a bit about how pain works, let me show you some simple movements that you can perform at home to determine with a very high likelihood that your back is not a part of the problem. Meaning, if you do the following moves and you have no pain in your buttock and or your leg, meaning you cannot reproduce the pain by moving your back, then you can feel fairly and or very confident that your back is okay and likely not causing your butt or leg problem. And so while doing these movements, ask yourself, does this reproduce or make worse my butt or my leg pain or whatever pain you're feeling, again, in that area? All right, so the first motion you're going to want to do is what I call a seated forward bend, okay? And what we all call a seated forward bend. There's nothing special about it. All right, so if you have a pain in your butt, though, what might make it confusing is that you might have pain sitting because of the pressure or whatever. So what I want you to do is go ahead and hang that buttock off so we remove the element of compression or pressure, and we can just look at the impact of moving your back. All right, so we can isolate that variable. And so what I want you to do is, look, also, if you have pain in both butt cheeks, well, you don't have to float and do this, all right? So just find as much comfort as possible. Maybe sit on a pillow to lessen the pressure effect, okay? So what I want you to do is, let's just say I have pain in my right butt cheek. I'll hang that one off. Is go ahead and just bend towards the floor as far as you comfortably can and ask yourself, does that make my butt or my leg pain worse? Yes or no? Then what I want you to do, the second move that I want you to do, is bend over top of the right leg. So put your hands here and bend over that way. How does that feel? Any buttock or leg pain? Yes or no? The third movement will be leaning over top of the left side. So forward bend to the left. Does that cause any type of pain in the butt or the leg? Again, your familiar symptoms on the right leg in this case. All right, so you just tested moving the body forward straight ahead, forward to the right, forward to the left. Now we're gonna go side to side. So what I want you to do is I want you to stand here, feet about shoulder width apart, put your hands on your hips, and I want you to kink your trunk straight to the right. And so what this does, it closes down or shortens the tissues on this side of the body. It compresses the joints of the spine on that side of the body. And so I want you to ask yourself, again, does that cause any type of shooting pain into the buttock or even down the leg? That's to the right, and now let's go to the left. What does that do? And the final thing I want you to test out is kind of the backwards quadrants, right? The backwards direction. So what I want you to do first is I want you to stand, feet shoulder width apart, hands on your hips, and I want you to bend back as far as you comfortably can. Now that's straight back. We got to go a little bit further sometimes to pull out or tease out some of the sensitive areas of the spine to see if, we can cause your buttock pain. So what I want you to do now is go back into the right and back into the left. So here's how you're going to do it. Back into the right, you're going to twist your trunk first and then bend straight back. So that compresses and or again shortens some of the tissues on the right back side of the body, the back right. Now twist to the left and bend straight back. And just from a side view, I like to, when I'm going backwards, twist and put my hand kind of here. So I sort of have a fulcrum point and some support there. All right, so if you're going back to the left, it would look like this. And you're going straight back in that case, but you're twisting and then extending. All right, so again, just to review, you've got forward straight ahead, forward to the right, forward to the left, sideways to the right, sideways to the left, straight back, back to the right, back to the left. All right, so there you have it. I would recommend that you go through those 8 motions, try them out, make sure you go to the end ranges, right? Really make sure that that does not have any ability for you to reproduce your butt or your leg pain. If you go through those motions thoroughly once or twice, right, and you're like, hey, A-okay, Charlie, no problem, then chances that your back or an upstream problem is causing the pain that you feel in your butt or your leg, is not high, meaning it's not very likely. So if you do have trouble doing those things and you notice that, for example, you bend back to one side, it's a very common direction that will reproduce buttock or leg pain, kind of the backwards directions or back to one side, then chances are very high that your back, which you just switched or moved in some direction, is the problem. And so if you've been trying things to treat the pain in your butt by only treating the butt, then consider the reason that maybe it hasn't worked is because the problem is not in your butt and instead it is upstream in your back. So to summarize, you can have referred pain, right? And referred pain again is pain in one area that you feel or is referred to another area, which makes it very easy to sort of miss the mark. You feel pain in your buttock, you think naturally it's a problem in my butt, right? But it might actually be a problem in your back. Upstream problems, like a back problem, can cause or refer pain downstream, the butt being the most common site of referred pain from the spine. Also consider a common denominator. A back problem or an upstream problem, because it can refer pain to anything downstream on one or both sides of the body, it's very common that you might get various diagnoses depending on who you see. So the back doctor, again, a back problem, hip doctor, hip problem, IT band, Piriformis Syndrome, hip bursitis, plantar fascia problem, Achilles tear, knee problem, blood clot. We could keep going on, but that is not very likely or probable, all right? So consider that there is a common denominator or one thing explaining all the symptoms you feel, and again, it is usually either very upstream, brain, a little bit more downstream, back causing these referred symptoms, just like I showed you how to kind of rule out to make sure the back was not the problem, and or you could have a sensitive sciatic nerve, which can cause pain anywhere along its path, and that nerve runs all the way from the back all the way down to the bottom of the foot. So hopefully this is helpful and hopefully this saves you some confusion and or chaos, as well as some time, energy, money versus just, hopping around to different physicians or specialists trying to make sense of this all. And by going through this video, maybe you just learned that your back is in fact fine. And maybe you were right. Maybe you thought, hey, it's got to be a butt problem or something in that area. And Charlie, went through all your back motions and it was totally fine, dude. Well, then that's great, right? But maybe you're still confused as to the cause of your symptoms. If that's the case, right, check out my Better Than an MRI DIY diagnostic guide where I go through all the other things that could cause and or refer pain to your butt cheek and or anywhere downstream. Hopefully this was useful. Be sure to like this video, be sure to hit subscribe as well as the bell for notifications when I go live every single week, and be sure to leave me your thoughts in the comments. Is there anything else you'd like to learn and or anything else you need clarity on?